Good afternoon, everybody. My name is Robert Puentes. I'm the president and CEO of the Eno Center for Transportation. I want to welcome you to the latest in our series of Eno webinars. This is our Road to Recovery series, which focuses on leadership lessons and transportation strategies for our post-COVID future. You can tune in every Wednesday to hear and interact with leaders all across the transportation space who share their firsthand knowledge, experience, ideas, and perspectives on the road to recovery. And today, I'm really happy that we have three stellar experts with us. I think this is the first time we've done a panel discussion. So I want to thank each of them for joining us. We have Grace Kernigan, who's most recently the general manager of the Bay Area Rapid Transit in the San Francisco Bay Area. We have Darnell Grigsby, who is a director of policy development and research at the American Public Transportation Association. And Christopher Pangilinan, who is the head of global policy and public transportation at Uber. Thank you all very much for joining us today. This is going to be great. We are going to focus on the federal role in transit's post-COVID recovery. For those of us who are joining online, you can submit questions using the questions function on the webinar website. We invite you to submit questions at any time. You don't have to wait until the end to submit questions. So as we all know, transit has been hit very hard by the COVID-19 pandemic, as have lots of areas of the American economy. But stay-at-home orders, things like that, by definition, have dramatically reduced ridership, reduced passenger fares, and reduced tax returns and tax revenues that support public transit. We know that things are opening up in many states, especially this week. We also know that these are states that have seen spikes in COVID cases recently. So these ongoing health concerns, I think, means that the timing of return to normal operations is far from certain. There's still a lot that we really just don't know. But in the meantime, transit demonstrated its value as a critical service during the pandemic, not just for essential workers, but also those who rely on it, most importantly. The federal government recognized this and gave $25 billion in emergency funding for transit and allowed it to be used for operations, especially at major agencies, not just for capital improvements. So we're going to get into what else the federal government should be doing to support transit, or what they should not be doing also to support transit and keep public transportation moving. But a big part of the challenge, I think, is trying to figure out, well, what is actually transit going to look like? I think a lot of the national narrative now is about, well, things are going to look different, but I think there's still an awful lot that we don't know. So let's just start off with a broad question for each of you. As I said, we all recognize the importance of transit. But do you think that these strong headwinds that we're facing, the need for physical distancing, the funding challenges that we're facing, workforce concerns, does this mean that transit in the future, either near or out in the future, are going to look different? It's going to look different than it did, say, in mid-February. So it's a big question for each of you. We'll start with Grace, Darnell, and we'll go to Chris.
There's a lot of uncertainty that's out there, and I think transit reflects the rest of the country. So the uncertainty is for each individual agency, but it's also for the total sum. So when you say what's it going to look like, it's going to be different for different systems. And I think you're also going to see a lot of change within the system. So there's not one way, if I were still at BART, there's not one way BART would be. As a matter of fact, what characterized their reaction in the first 3 months was to constantly shift and change and try and find something that works. So each community has to work, each transit property has to work with their community and with their rider base, with their local elected officials, and keep communication open as they try new things. And that's the tough thing, is to continue to communicate with the riders. The other thing is to listen to the riders to see what it's going to take to bring them back in the right way. And if you can't bring them back in the right way, it shouldn't happen. And in the short term, I think you're going to see that uncertainty play out a little differently depending on the agencies. Everyone is trying to provide social distancing rules, regulations, things that work, and weed out stuff that doesn't. They're trying to keep up with the cleanliness and find new ways to provide that health security, if you will. And then I think as time goes on, there may be a few that actually go out of business. It's possible. Consolidations to some extent may also be another reaction that's there. And in terms of the long haul, depending on whether people work at home or come back, some of the systems may, I think, reconfigure themselves. Buses obviously are a little able to reconfigure differently than transit systems. So I'll just put those out there.
And I would add to that and say there's a couple of opportunities that we should make sure we take advantage of right now. One of those would be to reorient our street network, which for years has not really been something that supports transit or pedestrians that use transit. This is a great opportunity to take this crisis and do something good with it before we reach our usual levels of congestion on the streets, to reimagine what those streets could look like. Is also an opportunity for us to look at ways to further integrate mobility in our cities. So how do you make a more seamless network, mobility as a service, mobility management, making sure that transit is at the center of the future of mobility in our cities, because we are the ones to provide social equity. And social equity is an important thing to talk about right now as well. We know that transit is a ladder to opportunity. So the question is, how do we make sure we remain that ladder to opportunity? But how do we also reduce the stigma associated with using transit around the country? It should just not be a province of the poor. It should also be something that, what we experience in major cities, for example, like DC and New York, where you have a much expanded base of users for transit. The other opportunity is to become more resilient. And we have new practices like Grace talked about. Our cleaning standards are going to go up. I think the riders will like that. It's a chance for them to view us differently. And also, finally, there's one more opportunity, which is to reimagine transit values to the community. Oftentimes, we look at transit just from the standpoint of ridership. We need to also look at it from the standpoint of economic growth. Like I said, equal opportunity. There's ways to measure that in a way that can be measured over time in between systems, and APTA has been engaged in that to try to find a way to have a bigger conversation about transit's role.
Yeah, I would definitely want to echo what Grace and Darnell have said here. I would add that, it's fascinating how we see the ridership right now along in agencies due to the economy slowing down, staying at home orders, and of course the need for social distancing. We see ridership starting to mirror different areas. So what I mean by that is, like in San Francisco and New York, which used to see very high density ridership and a lot of peak service and peak ridership, is all of a sudden starting to reflect a much lower density area, even though those cities are still very dense and very vibrant cities. And so I think it's going to be important as we look at how transportation and public transportation agencies adapt to this, is to start recognizing that they're in a different city now, even though they're serving the same city. They're serving, San Francisco might be serving San Mateo level services, for example, but we still want the high frequency service that attracts people to transit, that makes it useful, that makes it attractive. And as we start seeing car traffic go back up, I think we've all seen the Apple Map graph data where car directions are going right back to where they were in January, but transit directions are still flat from the COVID era, that we need to be protecting these bus lanes, creating them, and making sure that we don't lose that initiative. And when we do return back to bus service to normal, they're not stuck behind all these cars and the service being less attractive in the future. It's going to be important to make that shift. The other area that I think is going to be interesting to look into is we'll need a lot more research into how exactly public transportation and this current health crisis actually interact with each other. I think we've been making a lot of assumptions, and a lot of it's because we just don't know. Even the experts don't know yet. But we're seeing evidence, perhaps in Japan or other very high density areas, that public transportation might actually not be as big of a vector as people think it might be. And I think we need some really good concrete research on that to make sure and to restore confidence that public transportation can be a safe way to get around, even in a dense bus or train.
Yeah, indeed. I think all three of you kind of outlined some of the things that we know and some of the things that where there's some uncertainty, right? This is all unprecedented. That word keeps coming up, but it's actually really applicable now. There's still an awful lot that we really don't know, and I think the definition of transit actually needs some more precision, because we know, and Darnell, I know you've seen this, that the rail and the bus experiences have been quite different, right? We've seen huge declines in rail transit here in the Washington subway, I think the MTA in New York. But bus ridership, not such a big decline, but maybe 50%, 60% in some cases. Still significant, but not as dramatic as rail. So for each of you, do we need a different approach to rail versus bus? Darnell talked about mobility manager, kind of looking at it big holistically, but do we need to parse these out differently because their experiences are different?
I think we need a different approach, not just, I don't think, Robert, that it's, Rob, it's not rail versus bus. I think you have to understand that every system is different. Paul Skatelis makes the joke that, you know, if you've seen one transit system, or I guess it's Peter Rogoff, if you've seen one transit system, you've seen one transit system. And just the dynamics and where the system feeds, who its customers are, how it relates to the community it's in makes a difference. So I'm sure there are groupings we could make, but I don't think it's bus versus rail. And I don't know if the bus indicates that it's folks that don't have a choice. We have a choice rider and an equity rider and a transit dependent rider. And as we break out the components of who's using it, we may have to tailor our services to make sure we're responding to the right customer. If you have a choice to get in a car, you're going to do that until the roads fill up, and then you may choose to, you know, venture back to transit, if it will. And we will have to rebuild our ridership, but I don't know that there's a split between, for myself, I wouldn't say there's a split between bus and rail. People are still trying to feel comfortable and feel their way back to what they know. And in San Francisco, just as an example, that the corridors that BART serves will, I think, continue to be the corridors that are there. And right now, a lot of people are staying home. A lot of people can work from home. And when they start to come back because they want that interaction, or because that's the nature of the work that's going to bring them back, then I think we'll have another set of questions. I think it's awfully early to know the answer. I think a lot of research needs to be done with the customer base and then paying attention to what other agencies are doing around the world.
One thing that you can see in the data that comes from vendors that provide real-time ridership data, there's been a differential between cities when it comes to decline in transit ridership, and part of that is because of the different industry mix. There's some communities that have an industry mix that lend themselves better to being a work from home environment, lend themselves to those who might have access to cars. And then there's other communities that have more of a base of service workers that are part of the essential services that we have grown to rely on. And those ridership declines have been less in those communities. So you can see that if you look at Move It data, for example, or Transit App data, you'll see those differentials between cities. And I think to put a point on Grace's point, is not bus versus rail, it's more of the environment in which these systems are operating that really is going to be the differential. I think one thing that unites them all is a need for state-of-good repair funds, obviously. To meet the growing demands, we also need to have additional money for expansion of service, because that will still be a feature that we all need to remain focused on.
Yeah, and Darnell, you took the words out of my mouth there. Exactly. It's just that differentiation between who's on the bus and who's on the train. And I think we see this really starkly in a place like Los Angeles, where and I forget the actual numbers, but the average annual, the median income on bus riders is far lower than the median income on rail. And you'll see jobs for bus riders are probably far different than the jobs for rail riders who can work from home. More of them can work from home. And I think what this is, it's a reflection of what our system was in the past. And maybe now the mirror is very bright now. It's like, okay, are we providing the right transportation services for our communities that need public transportation or that want to use public transportation? And just because we have to pull back on transit service, and I think we all understand this, and of course we all want more resources to be able to do this, we can't be pulling back on ridership services where people need transit the most right now, which probably is buses. And so I think what's going to be interesting is during this period now when we're in a lull in ridership, except for those who can't work from home, and then as we start getting back into recovery mode, hopefully soon, I think transit agencies and the transit world, all of us here have to look at what is the best way that we can serve people who are relying on public transportation, who don't want to deal with half-hour headways, transit agencies that can't be serving, maybe historically it has been good on a bus, but maybe more mobility management on demand style might work, or maybe there are other options that can help serve these areas that might be seeing 1 hour headways because of the service cuts that are necessary. And I think, as we all know, transit service and and the capacity don't always link well together. If we see a drop off in ridership and we drop service levels, we're going to see more ridership drops, people abandon the system, and it just becomes less useful transit. And I think we'll need to look at how we can maintain service levels in these communities without cutting so much service.
Yeah, I think that's a national narrative. We keep hearing them talking about, well, given these crises, we need to cut some low performing routes. And I think you're exactly right. This is probably exactly the wrong time to be doing that. I want to get into some of that in just a second, but let's talk about a little bit about the federal piece. We can talk about the kind of the future of transit, I think, all day. But so we know that the federal government responded in March. What else should the federal government be doing now to help in transit, both in the short and the medium term? We know that there's an infrastructure bill, a giant infrastructure bill that keeps getting discussed. That's still out there. There's a markup of a House bill today. But Darrell, let me start with you. What else should the federal government be doing to be helpful for transit in this time of crisis?
So one thing we definitely know is that state and local funding is dropping off because of the economic conditions. So when we talk about a state or local match for federal funding, that's problematic at this point. So we really need to start to talk more about how do we get to 100% federal share, and also can we use those funds for operating assistance, because we're still in a crisis mode here. Longer term, I think we should also be talking about zero-based review of the capital investment grant program, because we need to really streamline the approval process for that. So those are three concrete things that the feds could be helpful on, in addition to additional funding beyond the CARES Act funding. APTA put in a request for $23.8 billion. That was really based on fundamental research that we've done on the epidemiology of the crisis, the likelihood of a second wave, the impact on state and local funding, the impact on ridership numbers. So our numbers were very precise in terms of what the industry still needs in addition to CARES Act funding. So those are some concrete things that would be helpful for the industry right now.
Just one observation in addition to that, and I really think they need a CARES 2 infusion that's comparable, or CARES 3, I guess, to keep things going, to sustain things until we reach some normalcy. I don't know what that's going to be, but the other thing I'll point out is as the investments get made, and as we move into what might be something like a WPA investment to keep jobs going and that sort of thing, is now is an incredibly good time for rail systems to do state of good repair work. So if the plans are there, if you can just fund the plans that are there, we can replace the infrastructure that is needed at SEPTA in New York and BART and other places. BART has a very active program. A lot of it's locally funded. We passed a measure a couple of years back that's helpful so that they can continue to fund. But because hours have been cut back, it's a great time to go in and give your nighttime work, get 2 or 3 times the amount of work you would normally get out. So it's a good time to invest in a rail system and get the system back in order so it's there when the world resumes itself. And so any kind of funding that could be provided to systems that already have either plans in place, or it doesn't take much to figure out what needs to be done, I think would be an added boost and would sustain existing investment, which the country has needed for a long time. Roads and highways, the same thing.
And debt is cheap right now too. Sorry, sir.
Oh, no worries, Rob. I was going to add that I think there's like 3 things here that I could see that are happening. One is this bridge funding that we've all been discussing and making sure that agencies have the funding they need to continue with the drop off of ridership, fare, and state and local funding. The second one is looking at potential to accelerate what FTA has been doing with mobility management and the MOD, the Mobility on Demand program, and ensuring that agencies are able to, and this especially applies to something like paratransit, where if we are looking at service cuts, the whole quarter mile idea of providing paratransit around a quarter mile of fixed route could change if we're shrinking that fixed route service area, the transit area, and to be able to make sure that agencies are able to take advantage of a lot of the learnings from the last 4 years of the MOD, the Mobility on Demand program, and implement some of those lessons in order to preserve service, especially for people with disabilities and people who are relying on on-demand and demand-responsive public transportation. And finally, just getting back to that research angle again on medium-term, reassuring people that transit, again, is a safe place to go. I think New York City Transit saw this in a different way back in the 80s when the subway was seen as not a safe place to be. And actually, you have a lot of New York residents who lived through that actually never get on the subway anymore, even before COVID. They'll only take the bus because of that perception. We don't want to have that happen again with COVID. We don't want a generation of people who are going to be here in 20 years saying they never take transit because of the fear of a virus. And so we need to be getting on that now before that becomes ingrained in people's minds.
And there's a lot of experimentation going on in that regard. I mean, people are trying to figure out what really works, and there's nothing that's really come out about transit that makes it unsafe. In fact, the reverse, and I think Christopher was trying to put some of that on the record. So I think the more we experiment and have some data out there that we can communicate, the better everyone's going to be.
And I want to drill on that point. There actually is a bunch of questions on that thing, and I had one question ready to go too, on this issue of experimentation and pilots, because this, even before the pandemic, this was a time transit agencies were experimenting all over the place, right? This was a really innovative time. All kinds of neat things were happening. The pandemic has obviously changed that a little bit. Does that continue the same way? Does it look differently? I think Darnell or somebody talked about bus redesigns, for example. Agencies were looking at those as something that they should be looking into. Is this the right time to be doing that, or do we need to get things stable first before we start ramping up the experiments and the pilots again?
I don't think you can stop the agencies from experimenting. Darnell may want to go into more examples, but in Seattle, they're putting a bar across the, the front part of the bus in order to keep folks from approaching the driver. And then they have some ways to cordon off seats so that people can pace themselves out. There's symbols that are being put on the floors and a lot of different systems. You can't stop the agencies from trying. And I think just making sure we're learning from them and communicating that out. APTA always does a great job of that, and that'll give us a chance. The important thing, though, I think is at the federal level, since that's this discussion we're having today, the Congress needs to provide the FTA permission to allow flexibility for the agencies to adjust. To go back to my first point, everyone's a little different, and some people may need more time to fill out their planning, as they're analyzing things, instead if they're coming up against deadlines. FTA needs to be given permission and instruction to be as flexible as they can. Darnell pointed out the match, and that is, it'd be great to have more federal funds in the match, but there are a whole bunch of other federal rules and regulations that make it tough to run an agency, and just a little bit of flexibility would go a long way to allow these unique agencies, if you will, to find a solution that fits their community and help to rebuild ridership and keep the community safe.
It's notable that there's been so much innovation in the transit sector because it's really difficult for the public sector to innovate given stakeholder engagement and regulations and historic lack of funding. But I have a long list of innovations that our agencies have done. We put out a daily email that we send to our CEOs just to give them a sense of what's happening around the country. And there's automated delivery services that people are trying. There's mobile hotspots in San Antonio where they're using buses as hotspots so that students can do learning from home. You have delivery of vital meals and groceries. DART is doing that. You have alternative transportation along suspended bus routes that people are trying. Miami is doing that. Complimentary door-to-door service for healthcare workers. That's something that's being done in Minnesota. There's a lot of innovation occurring because people have to rise to the moment to really meet the demands of their community. So I think as communities have needs, transit agencies are going to try to meet them the best they can. And one thing we're trying to do on the national level is really catalog those and try to make sure that we have the federal regulatory and policy environment to actually encourage those innovations to continue and to become even more prolific.
Yeah, I agree 100% on that. I think the innovation part is going to be key here. And again, FTA and the Congress was doing a great job of encouraging this before COVID, and now is the time to really accelerate this. I think the definition of innovation is about change, right? And I think the ground has slipped underneath all of us, and we need to be figuring out what is that change that we need to stay on that ground and be better on that ground. Right now, people are not commuting to offices 9 to 5 anymore as much. People are going out to bars and restaurants at night. And our transit systems were designed, our whole transportation system was designed around that lifestyle before, or the midnight shifts, all these things. And now we need to be recognizing, okay, how are people getting to work? What are the grocery store workers doing? What are the hospital workers doing? And actually, these are probably questions we should have been asking before COVID, but now it's really even coming up stronger now. And so this innovating and just getting behind that word a little bit more, adapting to what we are today is going to be key. And can we get the funding streams that are coming from the feds, from the state and the local areas to be able to do that? And just one example here is just what we've been working on constantly is on-demand paratransit and just on-demand public transportation in general. And I think that before COVID, we were just kind of slowly stepping into this space, trying to figure out, do single rides, for example, count in the NTD as a question? How do we do rider's choice models with paratransit? Well, I think we need to start really experimenting and figuring this out over the next couple of years. And it doesn't mean we have to abandon any principles of public transportation at all. I think we just need to see, how do we adapt these new services that we've been playing with the last 4 years into a real cohesive part of the public transportation system? And how do we learn from this over the next year or two, so that when we are coming out of COVID and recovering, we can figure out the right place for all these new systems we've been looking at, mobility as a service, mobility on demand, and so on.
And there's a bunch of questions, as you can imagine, coming in about TNCs and partnerships. I want to get to that in just a second, especially the federal role in that. But I don't want to lose this other point on. I agree about flexibility. It's a big country. Grace's point, every transit agency is different. We need to have that flexibility. The agencies need that flexibility. How about standardization? A bunch of folks are asking, is there a federal role in standardizing some of the reopenings, right? I think this is happening in the aviation sector, right? The same thing that the federal government is saying, here are the standards you got to get to in order to reopen, things like that. Would that be something that would be useful? And would it give the public confidence, you think, to come back? What do you think the federal role is in standardizing hygiene, cleanliness to come back on transit?
I think it might be a good role for industry to do that, and there are some conversations occurring right now about how to do that potentially. I think we probably have a better idea of what it takes. I should probably lead that effort, I would think. That would be my opinion, at least.
I think some guidelines coming out of APTA would be fabulous to have. I don't think I would waste anyone's time on trying to regulate it. Everyone's trying to come up to speed as quickly as they can. I don't know about airports. If you're trying to standardize airplanes, it's a little bit different, but some guidelines would be great. And if there's some, the 25 things you have to do or 10 things you have to do to get APTA's imprimatur, then, that would be a good thing. But I wouldn't go further than that. Everyone's really hustling around, and the information is flowing almost faster and changes being made than I think you could possibly regulate.
And folks are wondering about that, Darnell. Maybe this is more of a technical question. Is the money coming from the CARES Act? Agencies can use that. It's very flexible. They can use that for their, I know it's the cleaning efforts, right? What they're doing to make sure their agencies are, the hygiene is being practiced, all that stuff.
Exactly. One of the things that we're really happy about, one of the major reasons why the CARES Act had the funding it had in there, was to maintain the transit workforce and to try to keep the agencies going. And agencies are by and large using it for that purpose. We've done some surveys of our membership, and they're staying close to what congressional goals were for the appropriation. So, we're following the guidelines, what's expected of us, and it's going well so far. We need more assistance, obviously.
So this gets into then a bunch of questions, as I said, on the private partners. But let me start off with some kind of a broader one. Should the FTA be more flexible when it comes to procurement, right? So I guess this could include everything, the things that they're buying, but also the partnerships in which they're engaging. Have you seen that flexibility is coming from the FTA? And if not, what is the vehicle for that to happen?
I would add there, I think we've seen a little bit of that in the CARES Act. I think the CARES Act was written really well and broadly, so that to allow agencies to respond very quickly to this existing crisis. And one example of that is the recognition that, for example, when agencies are partnering with TNCs like Uber, that obviously Uber and others have had to pull the pool product, the shared ride product off the shelf because of social distancing guidelines. So being able to still provide public transportation services with an UberX, which is a single occupancy ride style service, was recognized quickly and put into place, which is great. And so things like that, I think, allowed agencies to, like Miami, as Darnell mentioned, Indianapolis has also worked with us on providing essential worker transportation during this time to be able to do that quickly. And I think that kind of response has been great. And I think what we can look back now that we're a little bit past the reactive stage and more into like the looking back and trying to figure out a way forward, is to see how those kind of areas in flexibility can help public transportation operators and private operators work together.
I think you want as much flexibility as possible. I haven't heard too many complaints about procurement, but flexibility in any area is good. What you want to do though is also make sure that there's a report out on, where you stretch the rules, if you will, and what was the result. So I think the FTA needs to gather that information and us to, collectively understand what we did. And someone's going to step the bounds beyond, and that's not going to be good. Figure that out, bring it back in. But right now, we're in an emergency situation, and as much flexibility as you can provide, assuming that you do track what goes on, I think is a very good thing, Rob. It's essential to the agencies. And one other thing Darnell mentioned, keeping the workers on board, the CARES Act that kept them funded, keeps your talent in place during stressful times when your inclination would be to cut budgets, cut service. Keeping your workers there is an extremely good thing. It keeps your talent available to help solve the problems. The folks closest to the work usually have the best thoughts and suggestions to bring forward anyway, but it allows you to live another day, the system to continue on. So I do think you're going to need another injection, though. People are coming to the end the end is in sight already. So I think you're going to need another injection there to keep people on board.
Yeah, I think you're exactly, we've seen this, and I know Darnell has seen this in transit agencies. The folks who are closest have the best ideas. They just need to kind of pull out those ideas. They can tell you about that. And there's actually a bunch of questions on the federal role. And is there something special the federal government should be doing to protect, or to not just, I don't mean just protect the workforce from the virus, but to protect the workforce kind of the transit workforce broadly? Obviously, CARES money goes to keeping them employed and things like that. But is there anything special that the federal government should be doing when it comes to transit workforce?
I do think, Darnell, sorry to jump in here. I just think the protection, if there's information that comes, we already know the protective gear that's required, and we can follow from the healthcare side of things. But if there's anything more there, spreading that information as quickly as possible. You've got to protect your workers and customers first. That's first and foremost is safety. It's just an extension of the safety thing. But Darnell, I didn't mean to, or Christopher.
Well, I would just say one thing we've noted is communities where transit agencies are noted to be a essential service might have better access to PPE. So that's one issue that should be raised in the future to make sure that locals know that your agency is actually on the front lines of your fight against pandemics and other types of emergencies. And to the degree to which the federal government can help encourage communities to do that, it would be useful for the industry going forward to make sure we have the PPE available for our workers.
This is an interesting question here because I think I absolutely agree with Grace and Darnell, and I think the situation is interesting with transit and also with Uber is that we've seen a shift to people staying at home more, and so there may be, for example, on transit, fewer rides, and maybe if we do have to do service cuts for whatever reason, social distancing or otherwise, we might see fewer runs to drive or fewer buses to maintain. However, keeping the employees over this bridge is absolutely important, as Grace mentioned, to make sure we already had an operator shortage in the transit industry to begin with. We don't want to be coming out of this crisis with another operator shortage. But at the same time, you see with Uber, a lot of our business has shifted to Eats. A lot of deliveries have been happening. I think I haven't seen it firsthand, but I know I've heard about transit agencies looking at doing deliveries for like paratransit users, for example, who might not be able to leave their homes anymore and might on a paratransit to go shopping, and rather could we bring the shopping to them as a paratransit users. So there could be ways to re-engage the transit workforce to do more of that. Because I think Guowei at FTA put this, he said that if the mobility needs to be looked at differently, and maybe instead of is delivery another way of providing mobility? Is it the same thing as getting a person to a store? Do we bring the store to them? Is that transit? Could that be transit's role during this pandemic also? And I think these are interesting questions that, again, get on the innovation in the way that we change now that the ground is shifted underneath us as transportation, as public transportation, people here. And I think these are kind of questions that we could look at least for the next 6 to 18 months.
There are some systems also that are pacing or providing the social distancing by adding service. So they put the longest buses they have out, and they're trying to provide additional service in order to provide the social distancing. So the labor force is crucial in that sense.
Yeah, I was going to note that we've noticed that people are really liking their articulated buses lately. They've been proved to be helpful, as Grace just mentioned. The other is, there are examples, what Christopher is getting to, of communities that are using this opportunity to deliver. And I think DART is one of those, providing special grocery pickup and delivery services for ADA and paratransit riders. So we're seeing that around the country. So a lot of those approaches are being used, and I think a lot of CEOs are talking to each other about how to do that.
And this is important to maintain the federal government's endorsement, if you will, of experimentation and trying some things. Because sometimes when the rules are in place, whether it's school district stuff, special events, that sort of thing, the rules are in place to keep some constituencies away from each other. And what we're doing as communities, I think, is looking at who can provide what for whom, just to keep everybody safe. And in that sense, I think we should let the federal government have some role in lightening up a bit.
Yeah.
Reevaluating later.
Letting the innovation flourish. And I think we've seen that transit agencies rightfully are hesitant. Sometimes they don't want to, I think, as your point, Grace, they don't want to run afoul of federal rules. They don't want to have anything. So making that clear and creating a climate for this kind of innovation, knowing that asking for forgiveness instead of permission, maybe, kind of thing. I don't know, but I think that makes a lot of sense, because we know there's ideas out there, and we just need to get them loose. Chris, I'm glad you mentioned paratransit. I was wondering how to work these questions. There's a bunch of things on paratransit, and the point is well taken. We don't want to set it up as bus versus rail or anything like that. It's a holistic system. Paratransit's a little bit different. If we know that there's been particular impacts on paratransit, is there a special federal role in recovery as it relates to paratransit very specifically for transit agencies? It's a big chunk of their budget. Is there anything they should be doing to help out in that regard?
Yeah, I think absolutely. Paratransit is an absolutely essential service, but it's also a very large part of agencies' budgets. And I think the way that we're looking at this now is, and I think we can all agree also that there's just a lot of room for improvement on paratransit, which was set out, 30 years ago with the ADA, and sort of an unfunded mandate, and it had these kind of rules cobbled together about 24-hour reservation and other items to make it feasible. And I think we're now in this area now where technology and the transportation networks that do exist, like Ubers and others, can really help accelerate the way paratransit responds to rider needs. We're seeing, like, for example, the eHail pilot in New York City Transit. We're seeing the MBTA working with on-demand services for paratransit. And these can absolutely revolutionize the way for people with disabilities can be much more spontaneous, can go out when they want to, instead of having a 24-hour reservation. Can use it for more than just the stereotypical work and doctor's appointments, and actually live their full lives with a on-demand paratransit system. And I think the federal role here could be, especially as we're looking at this new transportation reauthorization bill, is can the federal government seed these kind of innovations with agencies who are, perhaps are still looking at this from a little bit of an arm's length, like, is on-demand paratransit something that we can actually do at my agency? Yes, Boston is doing it. Yes, other people have been doing it, but how do we then interpret the federal rules around this? How do we use local and federal funding to make this work? And I think there could be an amazing role here during recovery and outward, so that when we're, in 2 years' time, paratransit is a completely different animal than it is today. And that could be thanks to a lot of seed planting and innovation starting from the federal government.
Couple of questions here, I think, Grace, about your point on CARES 3 or whatever another federal bill would be that's providing funding. Do you think that should be going directly, as Darnell was saying, I think, to state and local governments? Should be going to transit agencies? Where is the need right now as it relates to transit? What would be the best use of that right now?
We have formulas, and I would send it to the transit agencies directly. I think if you don't, you won't be able to track what happens if you don't send it to the agencies directly. And the need, if the requirements there to maintain labor, which it was with the CARES Act, or there was a tie there, I think you need to send it directly to the transit agencies. In the Bay Area, it goes to MTC, the Metropolitan Transportation Commission, and they allocate it, and they look at again, they have a number of different systems that are in different have different demands on them, but I would send it directly to the locals.
Exactly, and I completely agree with that. It should go to the locals, and that's actually our ask as well. It should go to the transit agency.
So when you say the locals, so the transit agencies, not to.
The transit agency,
Well,
no, not the city governments and the state. Yeah.
We're almost at time, but one more question that I wanted to make sure we asked. So we talked a lot about things the federal government can do. What if they don't do anything, right? We're in an election year. Washington is, what Washington is doing these days. What if Congress decides we can't do it? We gave it the office. That's we're going to wash our hands. We're just going to ride this out like everybody else. What happens to transit? How important is a federal response? Right, another federal response right now.
I think you'll find some systems shut down. I mean, I think you'll have some crises on your hand. And when we're very focused on equity in this world right now, and we're very focused on access, the very lowest income folks who are transit dependent are not going to have that essential trip that they need to take to maintain what employment their family's been able to maintain. So I think you lose that lifeline employment service that's out there. That's
Yeah,
my
I think
answer.
you see
Agreed.
Yeah, I'm sorry, Darnell. I was going to say, I think you see a complete reversal of all the trends we've been doing in urbanization the last 10 years. You're going to see car ownership go up. We're going to see people left behind and left out of opportunities in cities. And it's not going to be great. I mean, it's kind of the same question as what if the government didn't do an unemployment benefit for people? We would have had a tragic response in that as well.
We
Yeah,
need to
this is
hold
true.
on for a longer period of time before we're able to judge, what comes next. It's just unfortunate, but this reoccurrence that's coming back of the virus is going to take us longer to figure this out. And I just think we have to hold the line for a little while longer, and the agencies need the help directly.
And the projections show that this recovery is going to take some time. The 23.8 billion that we identified in additional need is over the next year and a half. So that takes us out until the end of 2021. So there's going to be need even beyond that date. We just happen to go through the end of the calendar year of next year, but this is going to be a slow recovery when it comes to the availability of funds. So any application from our federal partners would be problematic, as Grace just mentioned. So
that's great. Yeah, it's hard to. It feels like it's such a long time, but it is important to recognize we're still early in this, and there's a long way to go. So we're just about out of time. I want to be respectful for everybody. I really thank you so much for this discussion. This is exactly what we were hoping to get, and we heard loud and clear that we need to have the federal government to respond to the crisis that's going on in public transit across the country, allowing for innovation, allowing for flexibility, allowing for partnerships. So kind of a freeing up of the federal rules, but then also the money obviously is critical. We have to just face the reality that the federal government needs to do something to support these agencies because of the challenges that they're facing. I think we heard that very loud and clear too. So I want to thank you all very much for your participation. Thank you to Grace, Chris, and Darnell for doing this panel with us. Thank you all very much for participating as attendees and for the fantastic questions. We didn't get to all of them, but I think we tried to group them together. This is going to be put up as a recording later today, so you can share it with your friends and family after that. As I mentioned, this Road to Recovery webinar series takes place every Wednesday at this time. We have another webinar next Wednesday on how a better understanding of human decision making can help us navigate our way forward in a pandemic. I think it's a lot of things we just talked about here today. We also have a webinar next week, also on rethinking what public transit looks like in the future. You can check out our website for all of our work and webinars at www.enotrans.org. While you're there, you should check out Eno Transportation Weekly. Jeff Davis is doing all of the hard work and looking through the federal bill and the legislation. It's really important reading for everybody who's interested in what's going on here in federal DC. So again, thank you very much, Grace, Chris, and Darnell. It's great to see you all again. Thank you very much for your participation. Have a great afternoon, everybody.
Thanks, Rob.
thank you.
Thank you.
Bye.